cardiac rehab. There are 4 phases. Phase 1 is in the hospital, your patient period, after you've had the event, the surgery, the heart attack, the stent, whatever you've had. Phase 2 is the post-discharge but pre-exercise period. Phase 3 is the exercise and education program. Phase 4 is maintenance. So let's go a little bit deeper into those. In the hospital, phase 1 lasts 1 to 5 days, depending on the diagnosis. The goals are to assess the situation and safety. A couple of things that are critical. At this point in time, what you'll see is a couple of things that most patients don't really understand the importance of. It is critical post any type of event, but especially post surgery, that we do things to prevent pneumonia. So early walking and breathing exercises are critical, especially if you've had a bypass, they've opened up your chest. Breathing hurts. Deep breathing, the kind of breathing they're asking you to do. Walking hurts. And most patients, unfortunately, tend to assume walking and breathing are not that important. When you look at the statistics, the data, the evidence, by far, the most important things for living through an event like that, for healthy recovery from surgical procedures, is when you start walking and how well you do those breathing exercises. So those first couple of days, it's really not about diet. Don't fuss, don't worry quite so much about diet. Focus on your walking and focus on your breathing exercises. Those are critical. Then we get into phase 2, the post-discharge, hospital discharge, the pre-exercise area. And there are 3 goals here. Number 1, physical safety, further education, and preparation for the exercise phase. Daily walking, daily breathing, continuing that breathing work. Dietary changes are starting to become important at this point. This phase can be very challenging because you've just been discharged from the hospital. Quite often you'll get a ton of visitors, maybe not so much the past couple of years, but you still do. And it becomes major focus with your community trying to wrap their head around what just happened to you and what they can do to help and what they can do to prevent their own event. Phase 3, exercise, diet, and sleep. More education. This may start the day after discharge, usually not, especially for a bypass, for example. It may be up to 6 weeks before you're released into more intense exercise. This is where you get into that insurance-defined, insurance reimbursed, quote, cardiac rehab as defined by the insurance company. It typically involves 3 visits per week to a physical therapy or cardiac rehab facility, and it typically goes for 12 weeks. What you do as a patient is still more important than anything the doctor does during this period. During this phase, we need to develop the discipline and focus to make lifestyle changes or get back to lifestyle changes that we need to get back to and make them permanent. In this phase, even things like sleep are critical, but often overlooked. Gosh, I think it was about 20 years ago, one of my close family members was in her, I think in her late 60s, early 70s, and had a bypass procedure. She ended up still feeling bad post-procedure until about month 5. And here's what happened. They finally got her into more of a hill walk. She started doing hills on her exercise treadmill. At that point in time, she was working hard. And at that point in time, she started sleeping better than she had for the previous 5 months after the procedure. So again, you don't think about some of the things that really make a difference. To go back to the initial thing, patients tend to not think about the importance of breathing. It may hurt, especially if you've had that bypass and they've opened your chest up and you think, I can breathe in 3 or 4 days. No, you need to do that deep breathing as soon as you are able within the day after surgery, assuming your doc recommends it. Patients, again, often think, well, I can get to walking in a few days. No, as soon as you're cleared for walking, you need to be walking. Again, to do things that you might not be connecting the dots on when you're going through all of this. You may be focused on your diet, but you really need to be focused on breathing and walking because you're trying to avoid a pneumonia. In like fashion, in this space, you really want to be focused on getting as much heavy exercise as you've been cleared to do. It's helpful for the heavy exercise. The dot you may not be connecting is that heavy exercise allows you to start getting back to effective sleep that begins to restore your metabolism and your hormonal balance that are so critical to preventing these issues. Now let's go back to that last phase, that phase 4, root cause, reassessment, and maintenance. maintenance. And you know where I'm going to go on this. Yes, genetics are crucial drivers for cardiac risk. There's a significant portion of this channel members and viewers that have significant levels of what we call Lp(a). There's significant numbers of folks that have what's called familial hypercholesterolemia. There's one other risk that can't be managed, at least in terms of doing something about it. And it's one of the most important risk factors. That's age. But there are manageable risk factors that are incredibly important and, in most cases, far more important than genetic risks. Overeating, it's been a major preventable risk factor. Sleep improvements help. Stress, anxiety, depression from cardiac events, from all of the challenges of having been into the hospital. These things make it harder to change our eating habits. But those are the things that really make a difference in the phase 4 root cause reassessment. Reassessing root causes, over half of us, again, have prediabetes. Over 90% of us that have it don't know it. And guess what? Don't be sure that your doctor knows how to identify it. This was, again, headline from Science News from Johns Hopkins magazine. Most primary care physicians cannot identify all risk factors for prediabetes. As they say, that should be a wake-up call for primary care providers. I can tell you most of them haven't woken up yet. Other key aspects. The duration of a cardiac rehab program ranges, like we said, from 2 to 8 months. Some say they've completed their program when the insurance stops paying for it.